Okay, Kerri, it's now December 16th, 2010, and I've lost my voice.
Yeah. We switched spaces.
Yeah, right, that's right. We switched spaces, places. Okay, we're about roughly 9 months since the ketamine coma, roughly, correct? Now, I did evaluate 2 months after the ketamine coma, and obviously there were some significant improvements we noted at that point.
Yep.
We just did your pain thresholds, and we can see you're maintaining above your pre-coma levels, which is good.
Yep.
Not only that, but if you go back and you look at your original pre-coma video we did on you, you've lost a lot of weight. You're now down, you've lost about 50 pounds,
Yep.
which is good. Because that's going to take the weight off those knees and those ankles, okay? So that's a very good thing. The other thing I need to comment on is in the interim you've had about 3 sessions of boosters, or we call ketamine infusions. Each of those fusions were for 4 hours each on 2 consecutive days.
Yeah.
And they help you.
Yes, they have.
Okay. Now, what we want to do is go through the exercises with you. Ready for that?
Yep.
Start with the vertical finger test. Two vertical fingers in your mouth. Are you finding it easier to do that compared to the last time you were here? Okay. Less pain, right?
Yep.
The other thing we want you to do is take that right hand behind your head. Can you do that better than you did last time you were here? Okay. Are you just having pain there, or are you having?
Just mainly stretching, a little bit of pain.
Gotcha. Understood. Now do your left, please. There you go. Good job. Next thing I want you to do is I want you to take that right hand out in front of you. Open and close as fast as you can. Atta girl. Okay. You had an injury there not so far ago, right? Point to where you got injured over there.
In here, my thumb.
Right. So you got a hurting thumb right now, don't you? In the recent past.
Yes.
Now the worst side, of course, was always your left side. Open and close that hand as fast as you can. Now that is even better than it was before, isn't it? Yep. Much better. A lot better, correct. Okay, we're going to turn our attention down to your legs. We're going to take that ankle up. Rotate your ankle on the right side. Atta girl. Wiggle your toes. Okay, hitchhike back to Pennsylvania. There you go. Good. Now to the left. Rotate. Wiggle your toes. And hitchhike back to Pennsylvania. There was no way you could have done that before the ketamine coma.
Right.
And it looks like you've even improved since the last time I saw you. Okay, Mom's going to go up there just as a safety precaution.
Okay.
Oh, before we do that, Kerri, I'm sorry. I want you to close your eyes and go down there. You still have some allodynic. Work your way up. Stop when you get into it. Keep your eyes closed.
Yeah.
Right there? Okay, now come up again on the other side.
Over here?
Yep. Stop when you get into it. Right there. Okay. So you still have that. And I expect the water to desensitize that even more. The heated pool exercises.
Okay.
Okay? You ready to do some walking?
Yep.
All right, let's do it. Go on up there. And go back over here. And just go ahead and walk toward me, please. Atta girl. Good, good, good. Walk on back. Are you having any pain when you do that?
Just in my knee.
And which knee?
The left knee.
Left.
Yeah.
The right's okay?
Yep.
Okay. Now we want to see if you can tiptoe on 3 steps on your toes toward me. There you go. Good. Now that's hugely improved from the last time you were here.
Yep.
Yeah, you're much more in control. So what are you going to become, what they call ballerina?
I don't know.
You don't know?
Past that time.
All right. Go on back. Okay. Atta girl. There you go. Now do your heels now, which is a little bit more challenging. Mom, if she needs you for balance, that'll be fine. There you go. That's good. And we always knew your heels were more of a challenge for you. And I think your mom was commenting she can go up and down stairs where she couldn't do it before, correct?
Right. She was able to go up to her bedroom for the first time a few months ago.
Right. Right. Okay, come on, sit down, please. Oh, one more thing. Sorry, I forgot. You see that black cushion over there?
Yeah.
Okay, I want you to leap from there.
Oh, okay,
Yeah. All right. Okay. Okay. All right. So, Mom, what do you think? Is she feeling more hopeful? Has you seen a change in her perspective on
A
life?
big change. Being able to go back to school, I think, made all the difference in the world.
Right.
She still she's limited in what she can do with her friends. She doesn't go to any crowded places. She doesn't really go to loud places. I think
Sure.
the sounds are still
Sure.
a hard thing for her. But just the feeling of being back on her own and being more independent and being able to do more with her friends is a huge step ahead.
Sure, sure. And Dad, do you have anything to add to that?
Yeah, and, you know, we don't measure things day by day.
Good idea.
We look at and see, you know,
Sure.
now she's doing this. She wasn't able to do it a couple months ago. Or,
Exactly.
But,
You got the right idea. Right, right. And looking at exercise tolerance, and forget about the P word. You know the P word, right? That's not part of it. It's her vocabulary, but not yours. Don't use the pain word, okay?
Right.
Yeah. Focus on function, okay? And Kerri, do you have anything to add to any of that?
I was able to drive for the first time in a
Good.
year, so
Good.
that was a big accomplishment.
Right.
Yeah.
Now, if you're going to drive, you're still trying to get in shape.
Yeah.
You're going to have to take breaks so you don't
Yep,
get your
I
muscles.
drove for 5 minutes.
Good.
But that's
Yeah.
good first step.
Right. Exactly. Okay. All right. Very good.